show up. Yeah, it's
Yeah.
kind of it.
That's how it works.
But this will be very interesting to me. My father-in-law passed away from Alzheimer's, and I just lost my husband in July. I was his caregiver for 7 years. So I'm excited to see your presentation.
Well, let me introduce you real quick.
Okay.
Thank you for coming today. This is our continuing series of North Texas Assisted Living Foundation. Today we are honored with Jamie Cobb, who is works with James L. West Alzheimer's Center in downtown Fort Worth. James L. West Alzheimer's Center is dedicated to helping families stay together and live happy and healthy. Let's welcome Jamie Cobb.
Thank you. Thank you for having me today. I'm just going to dive right into the information because there's a lot to go over, and I want to make sure we have plenty of time to make sure all the questions are answered also. To start off with, just to define what the disease is we're talking about, because I know that some people still have some misunderstandings on what Alzheimer's disease and dementia are, because you hear those words used interchangeably quite a bit. Dementia, Alzheimer's disease, and some people don't know. Is there a difference? What the difference is? And what it is Alzheimer's is a type of dementia. So dementia is the umbrella term, just like cancer is an umbrella term. So you say I have cancer. Well, what type? And there's many different types of cancer underneath that term, that umbrella term. The same thing with dementia. You can say you have dementia. Well, what type of dementia do you have? And there's about somewhere in the 30s, different type of dementia that are out there. So you can say what type of dementia do you have. Now, some people, just to sidebar a little bit, some people don't know exactly what type of dementia they have. It's hard for a doctor to diagnose sometimes exactly what type of dementia you have. But how we care for our loved ones, respectively, we care for them the same way. And we're going to talk a little bit more about that, what to expect and how to deal with that as the disease progresses. But dementia is a group of symptoms that somebody has that is severe enough to interfere with their daily living. Their social abilities and their intellectual abilities are damaged. Their faculties, they're losing their faculties severe enough to interfere with their daily life. And for it to be dementia, there needs to be at least 2 brain functioning problems. So a lot of the times we see that short-term memory loss is one of those problems. And that needs to be coupled with something else, whether it's language. They have a hard time following the conversation or carrying on a conversation. They can't find the word that they're looking for. The language is just a little bit off. Maybe their personality has changed. Maybe they're not who they used to be. They're not like themselves anymore. Whether it's they're more paranoid about things, they get more agitated, more quick to anger. My mother, for instance, she was very much a homebody. Not a recluse, but very much she loved her home. It's where she wanted to be. She didn't like going to the grocery store. She drove to work and back, and that was about all that she could take about getting out of the house. When we started seeing signs in her, we had the short-term memory loss, but we also noticed her personality changed. She became much more outgoing. She wanted to go out. She would go with my dad to go do stuff all the time. She wanted to go to parties, different things like that. So it was different for Mom. It was different for her. Her personality changed a little bit. Excuse me. It could also be another problem that you might find if their executive functioning skills are hindered. And that is the planning out stuff. So maybe they've traveled all of their lives. And now you notice they can't put together a trip like they used to. Or they can't balance their checkbook anymore. Dealing with numbers is a little bit harder. When you're doing figure out a tip on the receipt at the restaurant, they just can't figure it out quite like they used to, or it takes them a lot longer, or they get it wrong. Something like that. You've noticed those changes about your loved one. A more common one is they get lost in familiar places. Have they been going to church every Sunday morning for the past 20 years? And one day when they're driving home from church, they get lost? Something like that. Those are not normal. But for dementia, there seems to be at least 2 problems that you see. So it's the short-term memory loss more often than not, along with something else, for it to be dementia. I consider dementia. In Alzheimer's disease specifically, what's happening in the brain is there are these plaques and tangles that happen, and it's caused by proteins. They're the beta amyloid proteins, and everybody has these toxic, they're beta amyloid proteins. They're there for a reason. They get flushed out naturally in normal functions. But for people with Alzheimer's disease, those beta amyloid proteins don't get flushed out perfectly, and they start misfolding and they start sticking together. So you can see on the right-hand side, the green things are supposed to be the amyloid plaques, those beta amyloid plaques, and they stuck together and so it started to create masses in the brain. And our brain is comprised of billions and billions of neurons, and those neurons tell us what to do. Our brain tells us everything to do. Our heart to beat, our digestive system to work, for us to talk, for us to take a step. It's all controlled by our brain. So when something like this happens between our neurons that are communicating back and forth with each other by synapses, that tells us to do everything, when those masses by these plaques start blocking that communication, those neurons start to die and wither away, is what's happening in the brain. And also, inside of the neurons, there are some tangles, neurofibrillary tangles, that they see. I'm not entirely sure how they get in there quite yet, but there's something happening on the outside of the neurons, blocking that communication, and also on the inside of those neurons also that are killing those neurons in our brain. So you can see right here, on the left-hand side is somebody's healthy brain tissue. Healthy brain tissue, and on the right-hand side you can see this is somebody with severe Alzheimer's disease in the very late stages. And you can tell that there's a difference. There's a drastic difference what's happening to the disease and what's happening in the brain. So like I said, those neurons have died, they're dying. And when that happens, the brain starts to shrink. And the gray matter starts to go away also. So you can see on the right-hand side, there's just more holes in the brain. I've used the description, you can take a styrofoam ball, and you can just start poking holes in it. And that's kind of what's happening to somebody with Alzheimer's disease. We can, however, predict how the disease will progress, because the neurons in our brain are also comprised of networks. So we have the language, our personality, our short-term memory, our long-term memory, our formal language, our automatic language, all of that stuff is in networks of our brain. So usually it starts at the very top there, you can see the blue part. That part of our brain is our hippocampus area. And the hippocampus network of our brain houses our short-term memory and our ability to learn new things. So that's usually with Alzheimer's disease where the disease starts. So that's why we always start seeing that short-term memory loss. Repeating the same thing every 30 minutes, asking you the same question, not remembering they took their medication that morning, taking double dosages of it, something like that. And then you can see as the disease progresses, it goes throughout the brain, to where it does start to affect our language, our personality, our into the very end stages of the disease, our fine and gross motor skills as well, to everything. And that is what's happening. Now we can predict it, but right here it's an individual experience. So the disease affects everybody differently. So there is, there's somewhat of a roadmap because we can predict how it will progress for the most part. But there's not a one-size-fits-all to each thing. Some people get a little bit more aggressive, I should say, than others do. Some people become really sweet. And that's just how it affects people. So my mother, for instance, she was a big worrywart all of her life. And when we started seeing signs, that part of her just became so much more exacerbated. We've got to take what's normal for that person. If they're quick to anger, if they're real sweet, or if they just worry a lot, there's still that person. All that stuff doesn't go away. It just might become a little bit more exaggerated by the disease. So we've got to take all that into account as well. Some people will also maybe not recognize family members later on in the disease. And some people will always recognize their family members. So it's very different, and we have to realize that as we start to care for our loved ones, especially if we're going out and we're going to support groups and getting help. And we're thinking, well, Joe Blow down the street tried this technique with mom and got her into the shower, and it's not working for me. I must be doing something wrong. Well, you can't think that way because it's different for both your family members. It's different how they're going to react to some different techniques that we'll talk about later on as well, but just to realize all that. So there's Alzheimer's disease. There's also vascular dementia. Vascular dementia is more of a blood flow or oxygen flow problem to your brain, not so much the protein problem. Because, you have lack of that blood flow or oxygen flow to your brain, and it usually will cause a stroke in your brain somewhere. Where that stroke happens, you will decline cognitively, wherever that is, whether it was in the language center, the hippocampus center, your personality center. Your cognitive abilities in that network will drop dramatically. And you might go along and you'll be just fine for a while, and maybe you have another stroke. And wherever that stroke happened, you'll drop dramatically again. You as a family member will notice a sudden change in your loved one. And you'll go along again, and you might be just fine, and have another stroke and drop again. So in vascular dementia, it progresses in stair steps. Whereas in Alzheimer's disease and other progressive dementias, it's more of a slide. Dementia with Lewy bodies. This one kind of looks like Parkinson's disease. It has the same movement problem issues. So we're graceful when we move like this. People with Parkinson's disease or dementia with Lewy bodies are more rigid when they move. It's just that Parkinsonian movement problem. They also tend to fluctuate a lot more. So they could be just fine one day, and then they wake up the next day and they're extremely down. Almost maybe comatose, where they're just sitting there staring at his face. And then maybe later on that evening they'll be fine. They'll be a little bit better. They just fluctuate a lot more. And they're also prone to more hallucinations. They just tend to get those a lot more. And this is a different type of protein in a different area of the brain that's attacking the brain also. And then there's frontotemporal dementia. This affects the frontal part, and the temporal, the side parts of your brain. The front part of our brain, here where your forehead is, houses your personality and your inhibitions. So when this part of our brain is being tapped, sometimes your personality changes dramatically, to where you might be doing some stuff very socially inappropriate, whether it's disrobing in public, or you become more aggressive, more agitated, just not yourself at all, doing crazy things. And then also, the side parts of our brain, the temporal parts, this is our language part. So some people have a very hard time, they're not able to understand language, and they cannot talk very well anymore. So it's very, very hard to communicate with them. And sometimes this disease will attack the front part, or just the side part, depending on wherever the disease starts. So it can be your language will be most affected, as opposed to your personality would be the most affected as well. Mild cognitive impairment. This is it's not quite dementia, but it is a risk factor for dementia. So I said earlier, for dementia you have to have at least 2 brain functioning problems. People with MCI only have 1. And usually it's that short-term memory loss you see. So you're having some short-term memory loss problems that are not a part of normal aging, but you're still able to do your daily living. Maybe you have to add more cues in your life, more post-it notes, more calendar reminders, and all that. So it's not quite normal, but it's not quite dementia yet either. There's only 1 brain functioning problem. And this is a diagnosis we're starting to see. Young onset Alzheimer's disease. This is when people get the disease when they are 65 and younger, even as early as in your 30s. And it progresses very quickly. You get it that young. Mixed dementia. This is the presence of both Alzheimer's disease and the type of dementia. A lot of times it's vascular dementia and Alzheimer's disease as well, but you see both dementias. And secondary dementias. This is if you already have a motor functioning problem or disease, whether it's MS or Parkinson's, something like that, so you already have that motor functioning problem. Later on in that particular disease, about 40% of those people go on to develop dementia as well. Now I want to talk about, are all of these dementias I've just talked about, excuse me. Alright. There we go. Are progressive dementias. I mean, now people with MCI or secondary dementias, they may or may not go on to develop full-blown dementia. But the young onset, the mixed dementia, the Alzheimer's, the vascular, all of those are progressive dementias. And we all know what progressive means. Again, it's different for everybody. But there are some dementias out there that can be fixed, that can be treated or reversed, or there's a lot of stuff that mimics dementia also. And I want us to be aware of this because in my family situation, I don't think my mom had full-blown dementia.
Okay. You weren't on the schedule today, that's what happened to you.
We'll talk about it later.
Okay. All right.
Some of these, in my family situation, my mother was showing symptoms of dementia. She had short-term memory loss, her personality changed a little bit. Some other symptoms were there. But I really don't think she had dementia. I think she had something else that could be fixed. And it just looked like dementia, had some of those same symptoms and problems. And what some of those are is if you already have an infection or a tumor or an immune infection in your body, it can cause the same symptoms of dementia. If you have a metabolic deficiency, whether it's B12, B6, or you have a thyroid problem, all of that stuff can look like dementia. But again, it can be treated and it can be reversed. Reactions to medications. I think most people might take 3 or more medications every day. And those medications interact with each other. It's chemical balance. Whether it's you just added a medication, you took one away, you changed the dosage of it, maybe you forgot to take a pill, and so you missed the dosage and you had to double up on it or something. All of that's going to interact with each other, and it can cause the same symptoms of dementia: the disorientation, the short-term memory loss, the not being able to focus, all of that stuff. If you have a heart and lung problem already, or you already have a lack of oxygen or blood flow to your brain, throughout your heart, throughout your body, that can cause the same stuff. Depression. 67% of the symptoms of depression are the same of dementia. That's a high percentage. And sometimes it's getting misdiagnosed. If you have severe depression, dementia, it looks a lot alike with each other. So we have to be aware of this stuff. Normal pressure hydrocephalus, that's fluid on the brain, and that can be fixed. You just take that fluid right off, and your signs of dementia are reversed. So it's treated. And I like to point all this stuff out because we didn't know this at the time. Our family didn't. And I think people are sudden, especially with the stigma that is still surrounding dementia and Alzheimer's, and the numbers that we're starting to see with it. I think people think, oh my goodness, I'm starting to forget things. Or my loved one sure is noticeably forgetful now. It must be Alzheimer's disease. We kind of jump to conclusions about things. And we don't need to. We don't need to, because there can be a lot of stuff that it can be. So I like to talk about the importance of an early and a proper diagnosis. When you start to see something that is different about your loved one, they need to go get that looked at. Normal aging is a subtle process, and as we age, things do change. Our memory does become a little bit less efficient. It takes us a little bit longer to recall information, or even process some information, learning new names. It takes a little bit longer, and that's very normal. Very normal. But when there's a sudden change or an acute change in one of our loved ones or ourselves, that's usually not a part of normal aging. Usually there's something there. Whether it's you can't see as well as you could last week, if you're starting to fall a little bit more, or you are starting to forget things a lot more, you need to go ask your doctor about it. And to get a proper diagnosis, usually will come from a neurologist or a geriatrician, usually. Our primary care physicians schedule appointments every 10 minutes, and there is no known test that will tell you whether you have dementia or not within 10 minutes. There's just not. There's not. And when you get a proper diagnosis, it's usually a full day of testing. There's PET scans, MRIs, CAT scans, medical history, blood history, family history, and a whole battery of psych tests. Because they want to make sure and rule out that it's not depression or you have a thyroid problem. And they want to make sure they know exactly what it is. And then you can start your treatment from there. How to take care of the problem from there. Nearly 2 in 10 Americans suspect they know someone with dementia that has not sought a diagnosis or treatment. And that's a lot. You can probably think back in your life, even right now, do you know somebody that has dementia? Or do you know somebody that you think has dementia? And a lot of people can probably pinpoint at least one person that they think is maybe not quite acting like themselves. And usually most people can raise their hand or something and think, yeah, so-and-so so-and-so might have it. But again, we want to know, we want to be armed with the information and know we don't have to jump to conclusions about something. But if we really are worried about it, for our loved ones, or ourselves, or anybody, to keep a record. Because it's hard to go up to somebody and say, you know, I think you've got some memory problems, you might have dementia or Alzheimer's. Well, and think about it, if somebody come up and said that to you, you might just laugh in their face. Or you might get real mad, you know, so we have to approach the subject carefully, like we would anything else when we love somebody. But keep a record. And this is easier to do, especially if you live with them, but just write down the observations that you see are different about your loved one. Maybe they did something funny. Maybe y'all went and ate at the restaurant last night, and your loved one just could not make a decision on what they wanted to order. Even when you narrow down the options for them, they just could not decide. Well, that's odd. It's odd behavior. So writing that stuff down, maybe they forgot to take their medication that day. Maybe they fell. You know, just writing all that stuff down for maybe like a week period, because you're going to forget some of the stuff that happens. You know, and that way we can have it with us. We can say, you know what, I've noticed a few things about you, I'm a little bit worried. Let's talk to a doctor about it. And that way you also have it to take to the doctor with you. It just helps. It helps us stay on target as well. And educating yourself like we're doing today. We're not jumping to conclusions because we know that there's different types of dementia that can be treated or that just mimic dementia as well. And talking about it. You know, like I said, I think there's still a stigma around the word Alzheimer's disease and dementia. And I think to get over it, we have to start talking about it. Especially when we start noticing something in our loved ones. And we owe them that. To start talking about it in a very safe and secure manner. You know what, I've noticed this about you. Have you noticed anything about me that I've been doing odd as well? You know, try to take some of that pressure off them also. Maybe we should go to the doctor together. Get a physical done for both of us to make sure we get a good baseline and make sure we're healthy from here on out. You know, there's different ways to approach something like that. But just talking about it and just saying, I love you, I'm concerned, I want to help out, I want to make sure that we're happy and healthy. And of course, getting a diagnosis from a qualified doctor. I've heard a lot of stories. People will go to their primary care physician, they say, no, you don't have dementia within 10 minutes. And that's what we want to hear, right? We're like, ooh, okay, well, good deal. Dodged a bullet there. Well, you still have the same problems that you did. You know, you've got to get a qualified doctor or a qualified proper diagnosis. I want to talk a little bit about what to expect in the disease. So we understand a little bit what the disease is. As much as we can understand it, we still don't know a whole lot about the disease, unfortunately. But I want to talk about what to expect as the disease progresses, because I think as caregivers, family members, friends that are living with these people with this disease, to know a little bit what to expect. I think it's fair. Because sometimes it can be a sad and shocking disease, but if we're at least aware of, we know this could happen or this couldn't happen, to our loved ones, the disease, and also how it affects the family, I think it just helps it be a little bit more easier to handle as we go. So in the early stages of the disease, our loved ones, they might have a hard time finding words. You might even notice they don't talk as much as they used to, or they've withdrawn, socially withdrawn. And it could be because they might know something is a little off, and they don't want to make a mistake. They don't want to embarrass themselves or embarrass you. And that's very normal also. They lose their way in familiar places, become disoriented when they walk into a room that they've been too many times, lose or misplace things. Also, it could be that they accuse you of some stuff, especially when they lose or misplace something. They're not able to retrace their steps. They don't remember where they set down their wallet. They can't retrace their steps. So if their wallet's not where it's supposed to be, well then obviously you've stolen it. That happens a lot there. You start to get accused of a lot more things also. But you know, it's great because they still have their social skills. They may not remember the most recent events, but they can probably remember who the president is. You know, but they still are able to have those social skills. So they're still can be very much a part of life. Just maybe need a little bit of help with the language part of it. But what happens to the family as you start to notice the signs or you get an early diagnosis as well. What do you do as a family? Because sometimes we'll get that diagnosis and then we're just standing there not knowing what to do. One of the first and most important things to do is get your legal and paperwork, financial and healthcare stuff put in order. And we want to make sure that the loved ones are included in that decision if they're still able to. And that is power of attorneys for your finances and for your healthcare decisions. What do you want towards the end of life? How do we want the end of life to go? What do we want in the funeral? And that's important to go ahead and get that stuff done while our loved one can still make those decisions for themselves, or at least have informed decisions. And they're able to tell you what their goals and wishes and wants are. So at the end of the disease, you're not standing there as their child or their spouse thinking, I don't know what mom would want. I'm not exactly sure. So going ahead and putting that in order is very, very important. And I've already said it, start talking, keep that communication and emotions open. Keeping it open, very important to talk about it because it's hard. It's very hard, but just, letting them know that we still love them, we're going to care for them. Because they're probably going to want to vent about their feelings and that they're scared about what's going to happen as well. And they need to know that you're trustworthy enough to be able to talk about that. And vice versa. They're still able to, you can still have that open communication with them. And even with the kids as well. Siblings, everything. Go ahead and start putting in written cues for them and exercise. Physical exercise is very, very important. Even if they've never exercised a day in their lives, it's just going to make them feel better. Their body is going to feel better. So they're going to do, when they're feeling better, we all do better, right? It's just going to make them feel better. And also our lifestyle, diet, I need to add that in here, but diet's also very important also. Because when we are eating good, we're feeling good, we're just going to do better, whether we have the disease or not. We're just going to feel better about ourselves. And when we're feeling better, we're going to do better. And in turn, whatever the disease or chronic problem you have, you're going to be able to function better with that. It's very important for our loved one who has disease. It's very important for the entire family unit also. Because when our loved one's functioning better, everybody else can function better. We need to understand that. And just helping them now. Establishing a routine is very, very important. Go ahead and getting that started earlier on. And I mean a routine like we wake up around the same time every day. Did your loved one always have coffee before they brush their teeth or after? Or do they do it both? Do they take a shower in the morning or do they take it at night? Did they exercise in the morning? What kind of activities are you going to do throughout the day? We're going to go to bed at the same time. We're going to have dinner and lunch and breakfast around the same time every day. We're going to do activities at the same time every day. We're going to go to bed around the same time every day. Getting that routine set in order, much like you would have a routine set in order for a child, much the same concept applies here. Because later on, that routine is going to be familiar for our loved ones. It's going to be somewhat comforting for them. And that routine is going to be much more important for you later on in the disease. When they're more familiar with what's going on, they'll be able to function better in that routine. So you have to start that routine earlier on to get that going. Go and do what you want. Have you always wanted to take all of your grandkids to Disney World? Well, then go and do it. Go and do it. If you want to go to Greece, go and do it. If you want to buy a dog, go and do it. Because it's probably the best one of the last times you can go and do all that stuff. And making sure that you have proper diagnosis. And medications. There are some medications out there that help our loved one do better for a longer period of time. There's 4